Welcome! As part of the Pandemic and Environment Challenge, we built a website entitled COVID-19: Understanding the Facts. The aim of our project is to simplify and provide some analysis of the data and information consumed by the British public from the media and governing bodies, and to make it more accessible and understandable.
During our initial discussions, we shared a common concern in terms of the data reported during the pandemic. The data was either too complex or created confusion among a non-specialist audience. We recognised the need to present the information in a more accessible way. By researching and answering the most commonly asked questions required a variety of skills, but we were able to dissect the information and explain its meaning effectively on our site. As an example, concepts used in statistics and technical terms such as vaccine efficacy and its effect on hospitalization rates.
Our research started by looking at the source of the problem, the transmission of the animal virus to humans. Human intrusion in untouched habitats driven by anthropogenic activities such as uncontrolled urbanization and the increased need for food production has displaced the disease reservoirs, hence creating the right conditions for a zoonotic agent to make the jump and thrive in its new host. The theory of SARS-CoV-2 originating from an animal host, presumably from a bat, and transmitting the disease to humans is very compelling, given the genetic information we collected from previous epidemics. This culminated in a new pathogen emerging, which caused extensive damage to human health and disturbed global economic stability.
We examined the methodology behind death rates and provided guidance on using simple statistics with the aim of providing a better understanding of the daily deaths attributed to COVID-19. The case rates provide great insight into monitoring the level of the spread of the disease. The information provided by the government offers a good example of the concepts we analysed and explained.
Initially, when the COVID-19 infection became a prominent concern, nations had not established concrete testing programs. The demands of the pandemic spurred on rapid and effective testing mechanisms that we are now aware of in general circulation. For instance, the lateral flow and PCR-based tests. The governing body's policies directly influence the mass testing programs and the effectiveness of their subsequent data collection. As the pandemic has progressed, the demands of testing and locating areas of high infection has also become more sophisticated.
The vaccines not only were developed in record time, but new and innovative technology emerged, the mRNA vaccine. This approach was possible because of previous knowledge of the MERS and SARS epidemics. When researching the vaccines, we recognized that the data regarding the efficacy of the various vaccines and the percentages published had a considerable importance. Our aim was to make it more comprehensible. Due to the speed and efficiency, doubts about the efficacy and reliability of the vaccines were put into question. As a result, vaccines have contributed to a large amount of controversy, confusion, and a large amount of distrust in the vaccination programs within the public, often being further fueled by the media.
Brief run through of our website. As you can see in our introduction, it explains COVID-19 and what our goals are and why we're doing this. In these tabs here, you can see the different places that you can navigate to on our website. For example, in cases, it shows the amount of cases we've had in the UK, and then it gives brief questions that you can learn more about by just hovering your mouse over here. This can also be done in the COVID FAQ tab. Taking it further, we believe that the best approach on making the website accessible to a wider audience is to run a media campaign. Working collaboratively with the university will provide us with a better platform in reaching our goal. A better understanding of how and why global emergencies occur will give people a better insight of how they can control their own behaviours and the steps need to be taken to mitigate future pandemic risks and how effective communication fits in this process. Thank you for your time. We welcome any questions at the Q&A session.